While watching the football games yesterday, I heard that repetitive head trauma can lead to issues with the pituitary gland. Is there evidence to back that up? There is. Not a lot, but there is. And the reason for those, I guess, non-science, non-healthcare professional people that are out there, the pituitary gland produces hormones that are used in your body for a variety of functions. The pituitary gland itself is in kind of a precarious place within the brain. It kind of hangs down from the core structure of the brain. It hangs down below the brain, and it hangs in this little bony pouch called the sella turcica. And with impact, just because of where it's located, it's in a high vulnerability area. And so the suspicion, obviously, is that potentially this could affect hormone production. And now hormones do a lot of different things throughout your body, and a lot of the signs and symptoms of hormone dysfunction are the exact same as what you would see in concussion. So, the pituitary gland controls blood pressure, growth, energy levels, sex hormones, thyroid function, as well as your metabolism. Hormones that are produced: cortisol, thyroid stimulating hormone, prolactin, estrogen, testosterone, and growth hormone. Now, the first step with this would be a pituitary function test, and that's something that your GP could run. And if in the event something comes back abnormal, the most common is going to be a hypopituitary function, so low pituitary function, and you might have a decrease in some of the hormone levels that are within the blood. If any of that stuff comes up, the next step would likely be a referral to an endocrinologist and possibly being placed onto hormone replacement therapy. Some naturopaths also can test for this. I know that the one we have here in Toronto tests for this with some of his patients as well. So just kind of getting into some of the literature, this is a review paper that was done on pituitary function. Previous literature shows that between 15 and 50% of patients with TBI develop permanent hypopituitarism, as high as 37.5% in mild traumatic brain injuries. This particular study found that 16% of MTBI patients developed new pituitary dysfunction over 6 to 12 months after injury. The most frequently cited hormone deficiency is in growth hormone. Now, growth hormone deficiency, some of the signs and symptoms of that are depression, decreased sexual drive or interest, decreased concentration or memory, fatigue, etc. So those symptoms overlap a lot with a lot of the common symptoms that people would present with following concussion. So it's important to look for some of the other things that may be off when you have a concussion patient. A study done in 2015. The aim of this study, this is Morrow et al. 2015. The aim of this study is to determine the prevalence of pituitary dysfunction in patients presenting with cognitive and mood complaints and or fatigability long after a concussion. So 38 subjects, 25 of those were male. Mean age was 36 years old, and the mean time from injury was 23 months. Results: no patients showed any posterior pituitary dysfunction. However, anterior pituitary dysfunction that required subsequent treatment was present in 60.5% of the patients within this study. Most common was thyroid stimulating hormone, adrenocorticotropic hormone, and severe growth hormone deficiencies. So basically our stance with CCMI is to always keep this in mind. We will refer for this throughout all of our clinics. If in the event you have somebody who's having prolonged symptoms that isn't responding to the typical stuff. Now, there's only been a handful of studies that have been done on this. However, the studies that have been done have found there to be deficiencies. So I think it's something to keep in mind because a lot of the symptoms overlap. And so if it is a hormone dysfunction, it's something that could potentially be treatable. I've done an Instagram post on this as well. If you go to concussion_doc on my Instagram, you'll find one that is on pituitary function and hormones in general.